Hi, it's Dr. Janine Johnson, and I wanted to share with you, just to give you information about what estrogen dominance is. This is going to be, of course, an interest to my female patients, and I do see predominantly women in my office, so women will be interested in learning or hearing about this, I think. And especially with all the hormonal shifts that women go through, sometimes I have women that come in, they've had their hormones tested. So typically what happens is you may have a blood draw, see what your estrogen levels are, and it comes back normal. And so why are you having all these problems? Well, the thing is when you have a blood test, it just checks you that moment in time. It's not looking at necessarily all your hormones. What we do in our office is we like to do a saliva test because we get the free form of the hormones. And we look at all your hormones, and we look at your cortisol, and so we look at how all the hormones are interacting with each other. So, for instance, estrogen is really not just a single hormone. It's a class of hormones and hormone-like compounds that have estrogenic properties, or the properties of estrogen. So we have human estrogens, animal estrogens, synthetic estrogens, phytoestrogens, and xenoestrogens. So a lot of different places you can get estrogen exposure. And so the estrogen dominance was coined by a guy named John Lee, who's a medical doctor. And some of the signs and symptoms, there's a laundry list, but I'll read some of them to you. Even when you have estrogen dominance, you have weight gain around the middle, you have allergies, you have autoimmune disorders, breast cancer, breast tenderness, cold hands and feet, which of course we see a lot of with our thyroid patients, muscle joint pain, depression, headaches, hypoglycemia, memory loss, mood swings. A lot of times when women are estrogen dominant, and it's really hard not to be almost estrogen dominant with all the estrogens that we do get exposed to. Really what happens is when you say dominant, your estrogen by itself may be fine, but when we compare it to your other hormones like progesterone, it's really a balance and a ratio that we're looking for. So things that can cause estrogen dominance, of course, can be hormonal shifts. It can be overloading the toxins, internally overloading your liver with toxins, and then externally the things that we're exposed to. So what we do again is we do a saliva test to look at the whole picture of your hormones and your pituitary hormones, the things that signal to your hypothalamus in your brain so that you're, when you're going through if you're still having a monthly cycle. What are the pituitary hormones doing? A lot of times they can be dampened if someone's been on birth control pills. So there's really a whole picture to look at to really assess what's going on with someone's hormones. So I hope you got some value from what I'm sharing with you today. If you'd like to leave a comment, feel free to do so. Share my information. Or if you want to connect with me, please leave a message or message me on Facebook, and I'll be happy to help you. You have a great day.